Hi, it's Adrian from Dental Artistry. I want to walk you through the case of replacing front teeth with dental implants. And it's always a very complex procedure when you are replacing a front tooth. One, because not only do you have to replace the tooth, but the gum and the architecture around the gum is critical for the cosmetics of the case. Ideally, if possible, we always try and place the implant at the time of taking out the tooth, because we actually know that we get the best long-term success and cosmetics if this is done. The other issue too is if we can place the final abutment, which is the component that goes on the implant at time of surgery too, it means that we don't have to take this on and off, and therefore the soft tissue response is much better. The issue with this case though is that it's her two front teeth, and if you look at the history, she actually had these two front teeth knocked as a child. They both died, and they had capping done, then root canal treatment done. The root canal failed, they redid the root canal, it failed again. They did apicectomies where they removed the infection by drilling the tips of the roots away. It failed again. And the situation was that these teeth had had a lot of treatment done. She did go for a second opinion to an endodontist, and they were thinking of doing the root canal again, but after considering the history of the teeth, how many times the teeth had been treated, and also the fact of what would the long-term cosmetics look like in this case if the teeth were kept, she decided the best thing would be to have the teeth taken out and replaced with dental implants. As mentioned, the main concern of replacing a front tooth is the gum architecture. When we're working on two teeth, these cases are very critical. So I'm going to walk you through the case and we'll catch up at the end. Okay, so this is the initial visit for Charlene, and we're actually just doing our first examination here, and you can see even from these portraits actually that she does have those grey lines or black lines on top of her front teeth, even from this sort of distance. When we actually start looking closely at her gums, you can actually see here the old crowns, of course, and you can actually see the chipped veneer on her left-hand side lateral, just on the corner there. But the most noticeable part here is the abscess or infection at the top of her left-hand side central tooth. This is a very large infection actually, and most of the bone is actually missing on the front part of this tooth. When we look at her videos, we use this in order to do our digital smile design. You can see that we've taken many angles, and the reason for this is to really analyze her smile well. From here, what we're actually going to do is, of course, use templates here where we're actually really analysing the position of her teeth and her smile very carefully. We're then going to, of course, discuss this with the ceramists, and this is Libby and Sue. We're really looking at her case and planning her case well. And from here, Libby's actually going to do what we call a diagnostic wax up. This is of a model of the patient's mouth, and we're actually going to plan the cosmetics of her case. This is day of surgery. You've already seen this photo. We're going to take the front crown off here on her right hand side, and you can see this is what we call a post. This is a metal post. The metal post now is actually coming out of the root, and we have to actually take the front two teeth out. And sorry for the graphic images, but this will actually explain the whole process here. There's the left hand side tooth coming out, and now you can see the condition of the tooth here. When you see the root has actually been worked on, and there's a 45-degree cut of the root, and this is part of the apicectomy that I talked about initially. So what's happened is we have actually, or a previous dentist has actually cut the root or the tip of the tooth out to try and eliminate the infection. But as I mentioned, it didn't really work. She's had double root canals on this tooth, and this just shows you the extent of how much treatment these two front teeth have had done. We're then going to actually place the implants on the tooth, and you can actually see here that I've actually started to drill the holes, and this is the position of where the implants are actually going to go. One of the most important things with these cases is to replace the teeth immediately, and this means not only placing implants at the time of removing the teeth, but also temporary teeth. And the reason for this is it actually improves the support of the gum and the soft tissue. And if we lose that, for example, the teeth are removed and we don't place implants, or implants are placed without temporary teeth, we tend to see gum shrinkage and gum change, and that gum change is very hard to actually compensate for later on. And we can see from these photos just a day after treatment, and again you can see the clotting around these front teeth, but you can see how nicely these teeth look. We can then compare the before video and of course the trial smile, and just make sure the patient's happy. And of course Another important thing is to get the team to reanalyze this. So we actually sit down again, and you can see here in this photo, Libby and Joe really looking at the case and making sure that everything's fine. We left, in this case, the area to heal for 3 months, and then we placed the final abutments. And if we can, we try and place the final abutments even at time of surgery now, because we know that this also helps the soft tissues. You can see the final abutments in this case, and then of course we place temporary crowns over these final abutments. We then actually have a new set of temporaries, or a new trial smile here, and we're really going to analyze this trial smile very carefully, and Charlene's going to give us feedback to make sure that she's 100% happy with the new trial smile. This is just some portraits, and you can just see the trial smile here. And then once Charlene was happy with that trial smile, we did go through a few, because she was very particular about how the case was actually going to look. The ceramists and technicians, Sue and Libby, actually start designing the porcelain. This is a view of the final porcelain here. You can see how beautiful the porcelain looks, and this is the porcelain inside the mouth. And then we're going to go to the final portraits here, and you can see what a great result the ceramists actually did on this case. Another portrait view here. And that's the end of the case. Well, thanks for watching Charlene's case. You can see that it was a very complicated case. There was a lot that we had to do to get the best result here. It was a real team effort here. We had ceramists that were doing all the porcelain work on the case, and you can see the end result was amazing. If you have any questions, please give us a ring at 1-800-SMILING. I look forward to one day seeing you in the practice.